Wearable devices have revolutionized how we track and monitor patients' health, providing real-time data on the vital signs like pulse rate, the ECG, respiratory rate, blood pressure, posture, for example, whether the patient is lying on the bed, or episodes whether the patient has fallen down, whether the patient is sleeping, and how good is the sleep. In this episode, we will delve into the concept of remote patient monitoring, where wearable devices enable the continuous monitoring of patients who are at home, in home care facilities or care home facilities, or patients who are recently discharged from hospitals, or persons who are in old age homes. This technology has significantly transformed healthcare delivery, offering improved patient outcomes and reducing healthcare cost. This should not be confused with CVSM or continuous vital signs monitoring in an inpatient setting or in patients admitted in a hospital, where the role of wearable devices in continuous vital signs monitoring is yet to be ascertained, and the value or the cost effectiveness of such a modality is still not proved by studies. So for all practical purposes, what we mean by remote patient monitoring is the use of wearable devices equipped with sensors to continuously monitor a person's vital signs and health metrics outside of traditional healthcare settings, such as in patients who are at home, who are immediately discharged from the hospital after a surgery or an illness, patients who are in old age homes, any other patient who needs to be monitored because of an illness. So it is designed to remotely track and collect real-time data on patients' health conditions, allowing healthcare providers to monitor and manage patients' care remotely. The key characteristics of remote patient monitoring, or RPM, are: 1. The location. The monitoring is conducted outside traditional healthcare facilities, such as at home, care home facilities, or post-discharge patients from the hospital. 2nd is, what is the purpose of doing this? It's primarily aimed at managing and monitoring patients with chronic conditions or post-acute care needs, enabling early deterioration of health issues and proactive interventions. And 3rd is, what are the devices that can be used? Wearable devices like smartwatches, patches, equipped with sensors to capture vital signs like heart rate, blood pressure, respiratory rate, ECG, and activity levels are the usual devices which are available in the market. 4th is patient engagement. This empowers the patients with increased independence and convenience, enabling them to actively participate in their care from remote locations. So this converts the patient into an e-patient, or what is called an empowered patient, where the patient becomes aware and is able to monitor his own health parameters and proactively participate in the care. And 5th, last but not the least, is care delivery. With a remote patient monitoring of patients outside a healthcare facility, this helps in a proactive care management, reducing the need for frequent in-person visits while improving patient outcomes and reducing healthcare costs. In conclusion, wearable devices and remote patient monitoring represent a transformative shift in the healthcare delivery. By leveraging the power of wearable technology, healthcare providers can extend their reach beyond the traditional care settings like a hospital, providing personalized and proactive care to patients wherever they are, whether they're at home, in a care home, in an old age home, or even when they are traveling. So this should not be confused with a continuous vital signs monitoring, which is done in the hospital, where patients who are in the critical care areas actually undergo a continuous vital signs monitoring. Whether all the patients in a hospital needs continuous vital signs monitoring, and what is the role of wearable devices, what is the sensitivity, specificity in picking up abnormalities in a setting of an inpatient care, that is yet to be evaluated and studied, and probably in the future, with more technology available and with more technology to analyze the large amount of data being generated, this might become another opportunity. But at present, with available evidence, there is no role for a continuous vital signs monitoring using wearable devices of all the patients admitted in a hospital. Thank you for joining us today. Remember to subscribe to this YouTube channel for insightful discussions on the intersection of healthcare and technology. Till next time, stay healthy and informed. Thank you. Dr. Gigy Kuruttukulam from Healthcare Futurist.